Hello everyone, I am Harsha, Speech and Language Pathologist at PRS Neurosciences, Bengaluru. This video is a part of Pediatric video series, and today I will be talking about pediatric feeding and swallowing. So pediatric feeding and swallowing disorders are something that goes mostly unnoticed, and from a baby's first feed to a toddler that might be experiencing different textures of food and different consistencies of food, these are essential parts or essential moments that might contribute a child's nutritional development, physical, emotional and social development aspects. So most of the time, even in otherwise healthy children, parents are concerned about their child's feeding abilities. However, only about 1 to 5% of infants and toddlers require active intervention, which might, wherein a child might be actively experiencing feeding disorders and which might lead to failure to thrive. Feeding issues are generally common in preterm infants, which might even contribute up to 30% and even up to 80% in children that are affected with some kind of neurological disorders or developmental disorders. We can also discuss about some main features to look out for in a child that might be possibly experiencing feeding difficulties. Normally, a child or infant would take approximately 20 to 30 minutes to complete a meal without any. However, sometimes children experience difficulties with this feeding and they might take prolonged times to complete one particular meal. And also sometimes parents might have to provide distractions so as to increase their oral intake. Parents also tend to force feed their child when they feel that there is not adequate food intake. All this might be stressful for both the child as well as the parent. Prolonged breastfeeding time, prolonged bottle feeding, difficulty in introducing new textures to the child, drooling from the sides of the mouth. Sometimes children tend to chew the food but not swallow it immediately. Instead, they'll keep it in their mouth, that which is called pocketing. Such issues with different textures and sensory issues. Those are certain things that needs to be looked out for to understand any kind of feeding difficulty in a particular child. Sometimes feeding difficulties might be transient in nature, which might be a part of some illnesses, some recent illness that might make it difficult for the child to eat the food. However, there are some other disorders that might actively contribute to a serious and severe form of feeding and swallowing difficulty. Let's see what are the common causes that might lead to feeding issues in children. One of the main factors would be any kind of neurological insult that might be present at the time of birth or post birth of the child, such as stroke, epilepsy, any kind of infections and so on. Another major contributing factor would be developmental disabilities such as cerebral palsy, global developmental delays and so on. There are certain genetic syndromes or structural deformities such as cleft, abnormalities in the esophagus, abnormalities within the oral cavity that might cause issues with swallowing. Certain medications that are used to treat some other disorders such as epilepsy might also cause drowsiness, incoordination, etc., which might contribute to feeding difficulties in children. Children with respiratory disorders, any kind of respiratory distress, are mostly under risk for aspiration due to disturbances in suck-swallow breath coordination. So generally, priority will be for breathing rather than for swallowing. So in such cases, child will be struggling to breathe and less priority goes for swallowing. So in such conditions, generally the underlying medical condition is treated first and swallowing difficulties are further managed. So all these general factors, general issues in swallowing that we already saw, such as prolonged meal times, distress during feeding, aspiration, or sensory issues, all this contributes to general uh, issues with health, okay, and poor growth of the child. So we as SLPs play a major role in managing these feeding and swallowing difficulties right from the time of a child's birth. In children who are suspected with feeding and swallowing difficulties, we do an active assessment, a screening and a detailed assessment and to understand the severity of the problem, understand the nature of the problem that is being exhibited, and so that we can tailor a particular or individualized treatment plan for that particular child. Therapeutic intervention might be in the form of modifying the diet, introducing different consistencies to a child who is refusing certain particular textures or consistencies, behavioral modifications, treating the sensory issues, sensory integration programs, and behavioral modifications, positioning, posturing, and also counseling the parents regarding how they can approach the issue. I hope these factors help you in understanding about feeding and swallowing issues in children and babies. So if you have a baby, or if you know a baby or child who is showing such symptoms that I've already explained, it's very important to get active medical attention at the earliest.